Tata Consultancy Services, Polycom and Presto, we thank you for extending our support to us. The entire Apollo group with the various like Apollo Telehealth Services, Apollo Telemedicine Networking Foundation, Medvarsity, etc. have all contributed to running this conference. We are particularly thankful to the 3 secretaries who were able to do a video conferencing with us. To you, Mr. Shapiro, thank you, sir, for coming all the way. And again, we have a very distinguished galaxy of people whom I'm not going to mention one by one. We would also like to acknowledge our event managers, Namdari, Splash Events, our webcasting partners, Hibis TV and Novotel HICC. Novotel, of course, are not just doing world class, they are going one step higher, which I think is India class, and I always believe that we should attempt to achieve India class, not just world class. So, thank you, ladies and gentlemen, and again, as I said, I'm sure I've missed a lot of people here, but I have one good news for you. We are interested in giving you food for thought rather than food for the stomach. So we will reassemble as on time, 1:45, even though we have cut into your lunch by about 10 minutes. Again, tomorrow we are going to have a joint plenary session with the Patient Safety Congress, where the Honorable Chief Minister of Andhra Pradesh will also be there as the chief guest. Thank you once again, and I look forward to a very, very productive conference over the next 1.5 days. 1:44 p.m. Please reassemble here so that we are on time. Thank you. We would like to have a formal honoring of our chief guest. Can I request Dr. Pratap Reddy to give a shawl to Mr. Le Shapiro?
We did have a phenomenal morning, and I must thank the wonderful speakers who started off this very important conference on transforming health with ICT off to such a great start. I was actually asking Dr. Ganapathy, and I said, Doctor, when did we start? And he said we started 3 years ago, and it was in Delhi in the year 2010. But if you go back and look at the content, which was really showcased in 2010, and you see what is really happening on the ground today, you will see like a lot of the initiatives which were actually discussed in 2010 are market solutions and solutions which are being adopted globally, whether it's, the states using ICT to make a difference on how healthcare is delivered, global trends. There's a huge difference in the way healthcare is being delivered, the point of care being shifted from, hospital systems to actually to remote locations, governments coming to play and saying that, how do we take care of the population who lives not only in the urban areas, but in the rural areas. And while we heard Mr. Shapiro make this, brilliant presentation on the global trends of how healthcare is being transformed, and then we heard the secretaries talking about the great initiatives which are happening and which have the potential to be path-breaking, which have the potential to make a difference in the way healthcare is being delivered, we have to look within our own country and look at some of the really transformational activities which some of the states have been daring enough to embark. Because, to take on ICT, to convince the actual users that it's going to be just not an enabler, but it's going to be a transforming agent itself is a huge challenge. And I think some of the states in India have done such phenomenal work that, when I was at the UN and there was this huge discussion last year about the non-communicable diseases and the kind of work which was going on, a lot of us who work quite closely with some of the local state governments know that, these transformational activities are actually happening within our own healthcare system. And sometimes, we tend to have this mentality of an underdeveloped nation. But today, the standard of care in India, the standard of healthcare delivery in India, the standard of transformation in India, just look at the teledensity. Look at the way people are using cell phones for ordinary solutions to market their goods. A vegetable vendor does it. Somebody selling milk uses a cell phone to really market their capabilities. And we as a country are the front runners to use mHealth, to use the cell phone to really take the healthcare awareness from the desks or the benches or the hospital systems which are typically in the cities to remote locations. So I think we have already started looking at ourselves as transformation agents, as path breakers, and the best examples again are the way the public sector is doing it. And today we're going to be showcasing 3 initiatives. One which is happening in the state of Tamil Nadu, the other one in the state of Punjab, and of course in the state of Andhra Pradesh where we all are. Our health secretary of Andhra Pradesh is a bit delayed because, when you're in your own state, there's just tons of work to do, and he will join us shortly. But before that, I'd like to introduce Mr. Rajkamal Chowdhury, Secretary Health and Family Welfare, Punjab. And we all know that there's some phenomenal activity going on in Punjab. And today they're the ones who have said that, let's look at not only health from an intervention point of view, but let's look at ways and means of keeping people healthy. So I'd like to introduce Mr. Rajkamal Chowdhury, request him to join us, and please present the phenomenal work which is happening in the state of Punjab.
Good afternoon, friends. I would like to thank the organizers for giving me this opportunity to present the various e-health initiatives which have been taking place in Punjab over the last few years. This opportunity is very important to us from the health department point of view. Not only is it an opportunity for us to have a look at what other states are doing, what the government of India is doing, but I think more importantly, it's very important to have an interaction with the people involved behind this whole e-health initiatives. How do we transform the health sector with the use of IT technology, with the use of information technology? That's very important to us. And as I go on in the presentation, before doing all that, I would just like to extend a welcome to anybody who is interested in working in Punjab in the health sector, who can assist us in any way in further, extending the scope of the e-health initiatives. There's a few slides. I think I won't take time because we are a little bit pressed for time. Some of the health indicators I'm giving here just to show that many of the indicators are better in Punjab than as per the national average. For example, the IMR, the total fertility rate, or the MDR is a little better in Punjab than the national rate. So I'll just start off immediately with what the government is doing in the e-health sector. We have a Punjab telemedicine project. I will come to that in a little bit more detail. We have many HMIS, health monitoring information systems, management systems, and we have developed quite a few online monitoring systems, applications. These would help us, are helping us in the various issues which I've mentioned on this thing. I'll take them up one by one. First of all, telemedicine, I think, was one of the first topics which we started discussing in the morning. And we all do realize that it's a very important concept in the sense that to give the health facilities to people living especially in the rural areas, the more we can introduce this concept of telemedicine, teleconferencing, teleconsultations, the more beneficial it would be for the people. So as far as the telemedicine project which is going on in Punjab at present, we started this in the year 2005. It started off, in fact, the Prime Minister had inaugurated this in 2005 from PGI Chandigarh, which is a postgraduate institute, medical education and research Chandigarh. 3 hospitals of Punjab were connected to this. At that time, it was done using ISRO technology, ISRO technology, and it was done through VSAT. Keeping in view the positive experiences from this telemedicine project that started then, in the year 2008, we connected all the district hospitals of Punjab to the PGI and also to the 3 medical colleges in the state. So in this way, we have on the average about 5,000 consultations, teleconsultations every year. And in this particular year, so far till July 2012, we have had more than 2,000 consultations. We do